When I graduated high school and went to college, I had no idea what an ophthalmic medical technologist was. At that time, I was very interested in something in the health field, but I wasn't for sure my career path. I came and spent several days with ophthalmologists here at UAMS and quickly realized that this was a very unique profession and one that is extremely rewarding.
I always knew that I had a desire to help people, and when I got my interview for this program, I got to come and shadow a student that was in my upper class, and I got to watch her work up different patients and see how she could help people, you know, have better vision. And I was just like, I really want to do that.
The technician is the person that takes you from the waiting room into the exam room and does all of the measurements for the ophthalmologist.
We start our days from when the patient enters the door to the patient has a complete eye exam, all the way to they have a return appointment and leave for the day. Ophthalmic medical technologists also serve as assistants in the operating room. We go to the minor operating room with our physicians in the main OR as well. We can assist in cataract surgeries, retina surgeries, glaucoma surgeries. If you were to think of a physician assistant or a nurse practitioner in the medical field, that's sort of what we are. We are extensions of the physician.
We could not function without the technologist in today's healthcare environment.
The opportunities you have are amazing because you're in a place where they see all kinds of injuries and odd diseases. You get to rotate out to Arkansas Children's Hospital, the VA, and then you also can do some choice rotations wherever you would like. Another great part of the program is they only accept a few students, and it's wonderful because you don't have 1,000 people in your class that you're going to be graduating with. Your teachers know your name and they know you, and you get every single bit of individual attention that you want.
Ophthalmic medical technologists all pretty much have similar personalities. We're all very outgoing. We're, patient-oriented. We always have a lot of fun. We're cheerful, but someone who also is able to work well with others. It's not a profession where you sit behind a desk and you look at a computer all day. You're interacting with patients, and so you have to be able to understand patients' needs and be empathetic with them, of course. And also you have to have a lot of strength. It's a difficult profession, not necessarily a physical difficulty, but emotional as well. You deal with telling patients they're going to go blind and that they'll never see again, and that kind of news is devastating to patients. So you really have to have a lot of the ability to understand a patient and put yourself in their shoes. And even though you have long hours and long days and they may be one of 100 patients that day, you have to be able to take time and sit with that patient and really understand them and guide them and educate them in their eye health.
The best thing about ophthalmology is that you get to help people in a tangible way that they can appreciate. They can come out seeing much better than before, and that can change the quality of somebody's life. For example, people lose the ability to drive because their eyesight becomes poor. You can give them back their independence, back their motility, and that's a life changer. You get people that their vision is so poor they can't see the food in front of their plate, and you can really hand them back their life, and it's very, very rewarding to do so. When
you lose a little bit of your vision, or maybe it's just not as clear as it was yesterday, people, they get scared. And when they can come into the clinic and you can do your job and help their vision improve and help the doctor, ultimately have a positive outcome, and maybe it's just a pair of glasses or surgery or whatever the case may be, that they're happy and can see.
I wake up every single day and I'm excited about work, and I love what I do because patients are just so grateful for what we provide.